Welcome to Lesson 3 of Module 2, Identifying and Reporting ADRs in Specific Medical Areas. Today, we will focus on ADR reporting for anti-hypertensive medications and managing cardiovascular risks. As healthcare providers, it is our responsibility to ensure the safety and well-being of our patients. Let's delve into the essential aspects of ADR reporting and its impact on hypertension management. Shall we begin? I'm John Smith, your learning expert and your guide for this lesson. First, let's start by understanding hypertension and the role of anti-hypertensive medications. Hypertension, or high blood pressure, is a significant health concern affecting millions worldwide. It is a major risk factor for heart disease, strokes, and kidney problems. Anti-hypertensive medications play a crucial role in controlling blood pressure and reducing cardiovascular risks. Hypertension often remains asymptomatic, so regular blood pressure monitoring is vital for early detection and proper management. When lifestyle modifications alone are insufficient, we turn to anti-hypertensive medications to help our patients maintain healthy blood pressure levels. Now, let's talk about the importance of ADR reporting for anti-hypertensive medications. Adverse drug reactions, or ADRs, can occur with any medication, including antihypertensives. ADR reporting is essential because it helps us monitor the safety and effectiveness of these medications and make informed treatment decisions. By reporting ADRs, we contribute to ongoing assessments of medication safety, leading to continuous improvement in drug therapy. These reports can help identify rare or previously unknown adverse reactions, enabling us to take appropriate actions to safeguard our patients. The data collected through ADR reporting significantly impacts treatment decisions. When we report adverse reactions, we contribute to continuously evaluating the medication's safety profile. This information allows us to adjust the treatment plan if needed, ensuring the best possible outcomes for our patients. In addition, reporting ADRs helps healthcare providers and regulatory authorities identify patterns or signals that may require further investigation. This knowledge can lead to changes in drug labeling or recommendations to improve patient safety. Let's now explore some of the common ADRs associated with antihypertensive medications. Please remember that individual medication responses can vary, and patients may react differently to different classes of antihypertensives. A. Diuretics. Diuretics are commonly prescribed for hypertension to help the body eliminate excess sodium and water, thus reducing blood volume and lowering blood pressure. While generally well tolerated, diuretics may cause some adverse reactions. Electrolyte imbalance. Diuretics can lead to the loss of potassium, sodium, and magnesium, potentially causing electrolyte imbalances. This may result in symptoms such as muscle weakness, cramps, or irregular heart rhythms. Dehydration. Increased urination caused by diuretics can lead to dehydration, leading to symptoms like dizziness, dry mouth, and fatigue. Orthostatic hypotension. Diuretics may cause a sudden drop in blood pressure when standing up, leading to dizziness or fainting. V. Beta blockers. Beta blockers work by blocking the effects of adrenaline, leading to reduced heart rate and blood pressure. Some common ADRs associated with beta blockers include bradycardia. Beta blockers can lower heart rate, leading to bradycardia, heart rate less than 60 beats per minute, which may cause fatigue, dizziness, and fainting. Cold extremities. Beta blockers can reduce blood flow to the extremities, resulting in cold hands and feet. Fatigue and depression. Some patients may experience fatigue, lethargy, or mood changes, including depression when taking beta blockers. C. ACE inhibitors and ARBs. ACE inhibitors and ARBs are two classes of medications that work by relaxing blood vessels, reducing blood pressure, and improving heart function. Common ADRs associated with these medications include dry cough. ACE inhibitors can cause a persistent dry cough in some individuals, which may be bothersome. Angioedema. In rare cases, ACE inhibitors may cause angioedema. Severe swelling of the face, lips, throat, or tongue, which requires immediate medical attention. Hyperkalemia. Both ACE inhibitors and ARBs can lead to increased levels of potassium in the blood. Hyperkalemia, which can be dangerous if not monitored. D. calcium channel blockers, CCBs. CCBs relax and widen blood vessels, allowing for easier blood flow and reduced blood pressure. Some common ADRs with CCBs include flushing. CCBs may cause flushing or a feeling of warmth in the face and skin. Swelling of ankles and feet. Some individuals may experience swelling in the ankles and feet due to fluid retention. Headache and dizziness. CCBs can cause headaches and dizziness in some patients. Let's now dive into some case studies to understand how ADR reporting can help us manage adverse reactions with antihypertensive medications effectively. In this case study, we have Mr. Smith, a 65-year-old male with hypertension who started taking hydrochlorothiazide, a diuretic. He reports experiencing muscle weakness and frequent leg cramps. The healthcare provider recognizes these symptoms as potential side effects of hydrochlorothiazide leading to electrolyte imbalances. The provider promptly orders a blood test to assess Mr. Smith's potassium and magnesium levels. The results indicate hypokalemia and hypomagnesemia, which confirm the suspicion. The healthcare provider advises Mr. Smith to increase his dietary intake of potassium-rich foods and prescribes a potassium-sparing diuretic to counteract the electrolyte imbalances. The ADR is documented and reported to the Pharmacovigilance Center. Our second case study involves Mrs. Johnson, a 55-year-old female with hypertension and migraines, who was prescribed metoprolol, a beta blocker. She experiences persistent fatigue and depressive symptoms after starting metoprolol. The healthcare provider recognizes the potential connection between metoprolol and the reported symptoms. After a thorough evaluation, the provider decides to switch Mrs. Johnson to a different class of antihypertensive medication. The patient's symptoms gradually improve over time. The healthcare provider reports the ADR to the Pharmacovigilance Center and advises the patient to undergo regular follow-ups to monitor her mood and overall well-being. Our third case study involves Ms. Nuwati, a 40-year-old female with newly diagnosed hypertension who started taking enalapril, an ACE inhibitor. She develops a persistent dry cough a few weeks after starting enalapril. The healthcare provider identifies dry cough as a common side effect of ACE inhibitors. After discussing the issue with Ms. Nuwati, the provider switched her to an alternative antihypertensive medication. The new medication effectively controls her blood pressure without causing a cough. The healthcare provider records and reports the ADR to the Pharmacovigilance Center to contribute to safety monitoring. In our fourth case study, we have Mr. Davis, a 50-year-old male with hypertension and diabetes, who was prescribed amlodipine, a calcium channel blocker. He experiences swelling in his ankles and feet a few weeks after initiating amlodipine. The healthcare provider identifies ankle and foot swelling as a common side effect of calcium channel blockers. To address the issue, the provider adjusts Mr. Davis's dosage and prescribes a diuretic to help reduce fluid retention. The ADR is documented, and the provider advises Mr. Davis to monitor the swelling and report any further changes. The adverse event is reported to the Pharmacovigilance Center to contribute to safety data analysis. Now that we understand the significance of ADR reporting and have explored common adverse reactions, let's move on to the best practices for ADR reporting with antihypertensive medications. Recognizing ADRs is the first step in ensuring patient safety. To achieve this, we need to stay informed about the potential side effects of antihypertensive medications. Regularly review drug labels, package inserts, and pharmacovigilance resources to enhance your awareness. Additionally, systematic patient monitoring during the course of treatment is essential. Pay attention to any concerning symptoms reported by patients and differentiate them from the symptoms of the underlying medical condition. Utilizing standardized reporting systems. When reporting ADRs, it's crucial to follow national and international guidelines for ADR reporting. Use standardized medical terminology, such as the Medical Dictionary for Regulatory Activities, MEDRA, to accurately describe and classify ADRs. Ensure that your documentation is complete and accurate, including the patient's medical history, medication details, timing of the reaction, and outcome. Thorough documentation helps in the comprehensive assessment of adverse events. Collaboration with pharmacovigilance centers. Timely reporting, Report ADRs to pharmacovigilance centers promptly and within the specified timelines. Timely reporting allows for the early detection of safety signals and ensures effective safety monitoring. Provide comprehensive information. Furnish pharmacovigilance centers with detailed and accurate information regarding the ADR. Include all relevant clinical data to support a thorough safety evaluation. Collaborate in investigations. Collaborate with pharmacovigilance experts during the investigation of ADRs. Share insights and contribute to data analysis to improve the understanding of medication safety profiles. Stay updated. Keep abreast of safety communications and recommendations issued by pharmacovigilance centers. Implement any necessary changes in clinical practice to enhance patient safety. Finally, let's discuss the role of pharmacovigilance in improving cardiovascular outcomes. Pharmacovigilance plays a pivotal role in monitoring the safety of anti-hypertensive medications and other cardiovascular drugs. By systematically collecting and analyzing data on adverse drug reactions, pharmacovigilance centers can identify potential safety concerns and take appropriate actions to mitigate risks. Through pharmacovigilance, we can identify rare adverse events that may not be evident during clinical trials due to limited sample sizes. Signal detection and evaluation. Pharmacovigilance centers utilize various methods, such as data mining and statistical analyses, to identify safety signals related to anti-hypertensive medications. These signals trigger further investigations to determine the causality and severity of adverse events. Risk-benefit assessment. Continuous pharmacovigilance enables a comprehensive evaluation of the risk-benefit profile of anti-hypertensive medications. By assessing the benefits of these drugs in managing hypertension against their potential risks, healthcare providers can make informed treatment decisions. Safety communication. Pharmacovigilance centers play a crucial role in disseminating safety information to healthcare professionals and the public. They issue safety alerts, warnings, and recommendations based on ADR data to promote safe medication use. Improving cardiovascular outcomes requires collaborative efforts from all healthcare stakeholders. Healthcare provider engagement. As healthcare providers, our active participation in ADR reporting is essential. We must engage in pharmacovigilance activities, report adverse events promptly, and contribute to ongoing safety evaluations to improve cardiovascular outcomes. Patient-centered care. Encouraging patients to report concerning symptoms and educating them about the importance of ADR reporting empowers them to be active participants in their healthcare. Multidisciplinary collaboration. Multidisciplinary collaboration among healthcare providers, pharmacovigilance centers, researchers, and regulatory authorities fosters a comprehensive approach to drug safety. Sharing knowledge and experiences enhances collective efforts to improve cardiovascular outcomes. Research and surveillance. Participating in research initiatives and post-marketing surveillance studies continuously improves our understanding of ADRs and cardiovascular drug safety. Research findings contribute to evidence-based treatment guidelines and best practices. Thank you for actively participating in this lesson on ADR reporting for anti-hypertensive medications. By recognizing the significance of ADR reporting, identifying common adverse reactions, and implementing best practices, we contribute to better patient care and overall pharmacovigilance efforts in hypertension management. Remember, your role in ADR reporting is instrumental in achieving safer and more effective treatment for patients with hypertension and cardiovascular conditions. By working together with pharmacovigilance centers and other healthcare professionals, we can enhance patient outcomes and promote a culture of patient safety in cardiovascular medicine. If you have any questions or need further clarification, please don't hesitate to ask. See you in the next lesson.